innovation, healthcare access, patient safety, dynamic organization, collaborative partnerships, and financial sustainability. They've got to have a decent business model going. Overarching all of these for every member of staff is the priority to deliver better patient and public involvement and putting patients first. Because if you can deliver better patient and public involvement, then you can deliver a much better framework market, shall we say, for the industry. But anyway, let's have a look at what June Raine had to say. Our response to the COVID-19 pandemic is proof positive that we can rise to challenges with fresh thinking and innovative approaches, fulfilling our responsibilities to patients first and foremost, as outlined in the Independent Medicines and Medical Devices Safety Review, and opening up the many opportunities now that the EU has left. Now that the UK has left the EU, with real benefit to the brilliant UK life sciences industry and to healthcare. So, David, I don't know what your thoughts are there very briefly, because we're already over time, but that looks to me like a business plan. They're developing a new market. They're looking for new ways to engage the public to make sure we're happy to continue paying for pharmaceutical profits.
The woman who was named after the long-range weather forecast is clearly out there to be a cheerleader, an enabler for an industry. This looks to me like a regulator completely captured by the industry that they're meant to regulate, which is so often the case.
Yes.
Well, I've got a little segment here on, well, Her Majesty the Queen.
Are we going on, or are we
Well, I think we should, Mike, because the end of it is we've got a little bit of an ad for a very good lady. So I'll do this very quickly.
Right.
But let's just bring this in. So I decided to go for the BBC because it was in front of me at the time. But here was Her Majesty the Queen awarding the George Cross to the NHS, praising all the staff. We picked up the story with the Express because they're claiming that they started the campaign to get this award for the NHS. So they've got this stunning image and an interesting article. Encourage people to read it for themselves. So what did Elizabeth have to say? She said, "It was great pleasure on behalf of a grateful nation that I award the George Cross to the National Health Services of the United Kingdom. It recognises all the NHS staff, past and present, across all disciplines and all 4 nations. Over more than 7 decades, and especially in recent times, you've supported the people of our country with courage, compassion and dedication, demonstrating the highest standards of public service. You have our enduring thanks and heartfelt appreciation." Now, we know there's many people working extremely hard in the NHS as it's been dismantled around them, but also there's some very murky things going on in the NHS. But let's just have another look at this. Here's the Express, obviously, and that smiling face. And let's bring in this, because we've got something rather different happening here. We've got medals for the NHS, but if you're a lady like Debbie Hicks, who was actually filming the empty hospital in Gloucestershire, you're facing court on Monday, the 12th of July. So interesting that the mainstream media is bigging up the good work of the NHS when people who took the trouble to film what was happening are saying, hang on a minute, because many of those hospitals or hospital capacity was empty. So we'd like to say, if you are free on Monday, the 12th of July, and you can be near Cirencester or you can be in Cirencester, would you look to give Debbie Hicks some support? And we're going to say, really be there for this brave lady, peaceful presence, be persistent, and be respectful in putting the supportive arguments across. The politer you are, the more powerful you will be, but we think this lady deserves some support for what she did to expose that the truth was not being told about what was happening inside the NHS.
So, any thoughts, David, just briefly before we go?
Well, it's just, where was the crime? How can she be in court when she didn't do anything? It's another example of the breakdown. Why was there nearly 1 million people, or around about 1 million people in the streets of London? It's because they saw their country being demolished, and they were saying, no, we don't consent to this. We don't want this. This is not the nation we want to build. We don't lock people up for telling the truth, or we used to not. Right? That's not who we are as a people. And that's the type of state that's being imposed upon us.
Yeah, she's in trouble because she's challenged the agenda of the British state, which can lie, deceive people, twist the truth, start the wars overseas. But if you challenge that, you're going to be in trouble. So what we've got to do is stand up and support this lady. Let's end on a positive note. We'd like to thank the individuals inside the BBC that have been kind enough to let us know there's been some high-level meetings over the last few days in order to discuss the fact that even the BBC's top management team is now recognising they're not exactly popular amongst the British public. Now, we haven't got details of what happened inside those meetings, but it was kind of individuals inside the BBC to let us know they took place.
Yeah, sorry, David, you're waving your hand, but we are massively over time.
I find a final snippet of information from the BBC. One of the gentlemen I was talking to at the march last Saturday had spent 3 days outside the BBC protesting. And not only did he get on very well with the security guards who came out to see him and were actually quite interested and mostly agreed with what he had to say, but the BBC employees, as they left the building, right, would give him furtive thumbs up signs, such that they couldn't be caught on CCTV, but they were still giving him encouragement. So the desperate beast that is the BBC is one thing, but the people inside the building are quite another.
Yes.
Yeah.
Okay, we'll be back in a few minutes for a little bit of extra.
Yeah. Thank you for joining us.
See you then.
Okay. Bye-bye.